Following a timely conversation with Dr. Dan Ryan and members of his team at the age-related health care department of Tallaght University Hospital in early March, the Institute worked with a range of key collaborators to develop a series of Project ECHO webinars in response to the COVID pandemic. These provided urgent and ongoing information and an opportunity for two-way communication between primary care staff working with residential and care home settings and services and agencies working with and for them. The webinars were 1 hour long and included a short presentation by a subject expert, followed by a facilitated questions and answers session with a panel of experts from a range of disciplines and organisations. Participants were encouraged to submit a burning question related to the topic of the session during their registration process for each webinar, as well as posing questions during each session. These questions and the feedback from participants help to shape the content of our future webinars. Between Thursday the 26th of March and Thursday the 25th of June, 25 webinars were delivered with 11,372 people attending at least one session. The majority of presentations were recorded and placed on the COVID-19 section of the Palliative Hub Professional for anyone with an interest to view the presentation along with links to other useful resources. So we wanted it to be a one-stop shop for people to go and access important information. By the end of July, the videos had been viewed 9,688 times. We would warmly invite you to view these resources at your leisure. As you can see, there were a huge number of organisations who worked with us to make the webinars a success. Many of those people are represented today in our panel and our attendee list, and we really can't thank them enough for their support. These are a list of some of the topics which were covered over the series of webinars. Emailed and texted feedback to each of the webinars was overwhelmingly positive from our primary care staff and from staff working in the aligned services. So comments such as it being succinct, meaningful and practical, as well as moving, invigorating and validating. And from one of our panelists, this was a very important opportunity to support our colleagues facilitate informed end-of-life care. So today is really an opportunity to reflect on what we have learned during our 3 years of engagement with Project ECHO, and also to consider how we might provide a sustainable future facing a sustainable and future-facing model of Project ECHO delivery for our partners, our primary care networks and our funders. We are delighted to have received such tremendous support from everyone who has been involved in this project, and to Hospice UK and to Project ECHO Northern Ireland, who have agreed to mentor us in our future endeavours. We do feel that Project ECHO has the capacity to both disseminate and shape policy and practice. Project ECHO has enabled the development of better working relationships among and between producers and users of services, and has generated new knowledge and understanding for all involved. Whilst the impact of ECHO phases 1 to 4 may appear modest, the learning and building of networks of like-minded enthusiasts enabled us to deliver a timely and effective response to the COVID-19 pandemic, and we hope you agree. We would welcome any feedback that you have and also your reflections on how we might move forward with ECHO in the future. And so with that, it's over to all of you.